Hello everyone, I'm Kibin Alleyne and today is Tuesday, September 17th. You are now watching Open, a program that brings the Bronx and New York City straight to you. Don't forget to stay connected with us via social media at BronxNet TV. Colorectal cancer stems from abnormal cell growth in the lower end of the digestive tract, often beginning as non-cancerous polyps. Detecting and removing polyps early can significantly reduce the risk of cancer. Dr. Bernabe Ramirez, a gastrointestinal oncologist at the Montefiore Einstein Comprehensive Cancer Center, joins me to discuss the latest advancements in screening methods and treatments for those at risk. Doctor, thank you so much for joining me.
Thank you for having me today.
Now, I'd love to learn a little bit more about the work that Montefiore is doing to assist individuals with colon cancer. So can you give us an overview of the center and the work that they're doing?
Yeah, so at Montefiore Einstein Comprehensive Cancer Centers, we have a multidisciplinary team that is composed by medical oncologists, surgical oncologists, radiation oncologists, GI pathologists, radiologists, where when a patient is diagnosed with colorectal cancer, we join together and then discuss the case and kind of like give a personalized treatment options. And then we go over to the plan and then offer it to the patient.
Now, I understand there's a Guardant Health blood test called SHIELD that screens for colon cancer. Can you tell me more about this effort and how does this new blood test detect colorectal cancer?
Yeah, so it is pretty interesting. This blood test is a cell-free DNA that is available for everyone who is above 45 years old to 85, which is the screening aid for colorectal cancer. It's a simple blood test that you can do in an office. And the idea behind it is because the tumor sheds cells into the bloodstream. So you can capture that by doing this specialized blood test. We do the blood test in the office, we send it to a special lab, and then we detect if there's any cancer cells present or not present.
Now, how will this impact the way the healthcare industry screens for colon cancer? And I just think about, we're so lucky to be in a time where, we kind of have these advancements. So how will it impact the industry?
I think it's very important because, right now there are different tests and different ways to screen colorectal cancer. One of them is colonoscopy, and that's the gold standard for everyone. And usually we recommend that. But it's time consuming. Like, patients need a good preparation, they need time off from work or from daily life activities. And then with this new advantage, just blood tests, again, you walk to the office, someone that is available to do the blood test, just take blood and then send it to a specialized blood bank.
Now, with that, I just hearing it sounds like it's a little bit more accessible for different types of people. Can you talk about accessibility and how important that is, especially when dealing or, in regards to colon cancer?
Yeah, so as I said, it's pretty easy to do. You don't need to do a preparation for the blood testing. You just walk to the office, and it's FDA approved already, so it should not be an issue with insurance. We just take the sample and send it. Yeah.
Now, I understand that in most cases, screening for colorectal cancer typically begins around age 45. Can you explain, first, why do we start around age 45? But, are there opportunities or situations where screening earlier may be recommended?
Yes. So in the past, we used to start screening for colorectal cancer at 50 years old, right? But back in 2021, the recommendation was dropped to 45 years old. And that is because we're seeing an increase in early onset colorectal cancer that has been slowly but steady since 1990. So, and we're seeing increase in patients younger than 50. So now the recommendation is for 45 and older. Right now, if there's any risk factors, then we suggest to do it sooner. Risk factors as family history or personal history of some like aggressive polyps, then we suggest to do colonoscopies or screening in general sooner than 45.
Now, with that, talking about risk, are there any particular high-risk communities or people who may be more at risk, and what should they do in regards to that?
Yes. So again, personal history or family history, relative, first degree relative who had colorectal cancer, we suggest to have a screening, colorectal cancer screening sooner than 45. If there is any genetic component like familial adenomatous polyposis or Lynch syndrome, then those in the special population, then we need to do a screening sooner than 45.
Okay, and I was curious, by communities, unfortunately, as sometimes we'll see like specific communities, like people from lower income communities may be more at high risk, or elderly may be at, high risk. Do we see that with colon cancer?
We see a tendency for Black Americans to have more aggressive colorectal cancer. And again, this blood test will be more accessible to everyone rather than miss work or prepare for colonoscopy. This again, just blood, and then we have an answer if you have or not have colorectal cancer.
And I definitely want to stress the importance of early detection. Can you talk about, just why that's so important? And, I know sometimes this can be a very stressful thing for a lot of people, but why that early detection could save a life?
Yes. So it's very important because prognosis varies between stages. Colorectal cancer goes from stage 1 to stage 4. And in earlier stages like stage 1 or stage 2, the survival is more than 90%. And probably you don't even need, chemotherapy or surgery. Just remove the polyp or the cancerous polyp or remove the mass, right? But if the cancer is diagnosed when it's advanced stages like stage 3, stage 4, the survival drops. And even for advanced stages like stage 4, the 5-year survival is less than 20%. So that's what is important to detect early to have a better survival.
Now, I know for a lot of younger generations, people that are even under 45, there's this fear about, colon cancer, and sometimes on social media you'll see people say that they're 30 or that they're 25 and they may be experiencing, what they believe is colon cancer. What are the symptoms and what are some things people should look out for?
Yeah, so early colon cancer can present with vague symptoms or even with no symptoms at all. So it is important to be an advocate for ourselves, for our patients. There was a study that shows that patients younger than 45 who were diagnosed with colorectal cancer, 40% of the primary care doctors were dismissed or they're misdiagnosed colorectal cancer, and they said, it's hemorrhoids. So be advocate for themselves, and we as providers, we should be aware that patients younger than 45 or young patients can have colorectal cancer.
And I think it's so important that you mentioned that sometimes a lot of younger people or people from certain demographics could be dismissed. What are some things that people can do if they feel that they may have experienced that? What can they do next to ensure that they are advocating for themselves?
I think again, advocating and say this is not me. I mean, usually again, doctors have an easy explanation, but if it's a persistent symptoms like blood in the stools, bloating, abdominal pain, but again something that is persistent, it should be looked up. We should be not dismissive of the symptoms.
Now, Can you tell me a little bit more about Montefiore's screening efforts just in general?
Yes, so we have a colorectal cancer awareness program where again in March, because it's colon cancer month, we offer testing. We have availability in different sites for colonoscopies. Now we offer this new blood test to everyone and the communities out there. There's outreach programs as well for the community, and again to assure that we detect colon cancer early.
Now, I think this is an amazing advancement in healthcare, and I think it's so, again, we're in a great time where we're seeing, technology and just all the things that can be done to advance, human health. What do you hope to see for the future of, just testing and screening for, serious, health conditions like colon cancer?
I'm hoping that the colorectal cancer is detected earlier and that we don't need to be more aggressive with chemotherapy, because again, if patients that are young and diagnosed with late stages, we are treating them but maybe not curing them. So early detection is the key. And again, this new blood test is an advantage, but don't forget that colonoscopy will be the gold standard still. It will detect cancer, but also polyps, and then at the moment of a colonoscopy, we can treat them, like remove them, and that will be it.
And I also want to add that, with the advancement of technology, unfortunately, there's also a lot of misinformation as well. So where can people go to make sure that they're learning, the right information about their body? And if they do have these concerns, what should they do?
I think it's important to look at the primary care doctors, right? Go to your physician, not just social media in general. Don't be skeptical of colonoscopies. I think there's a lot of, as you said, misinformation about procedures, and like they're scary. I mean, and every procedure goes with risk benefit, but again, this one saves life, right? So it is important to ask the right questions to the right people.
All right. Well, Doctor, I want to thank you so much for joining us and having this very important, conversation. As I mentioned, I've seen a lot of young people. I think probably in a long time, people in their early 20s, 30s talking
Yes.
about this. So I think it's so important that we're having this conversation. And it's so great to see that there's new methods out there to help people kind of learn a little bit more about their body. So thank you so much for joining us.
Thank you.
To stay in touch, please visit their website, montefioreeinstein.org/cancer. Don't go away. We'll be back with more Open right after this.